Now, in India's national capital, Delhi, the state government has rolled out urgent measures to combat high levels of pollution in the city. Now, starting 8 a.m. local time on Friday, the stage 3 of the graded action response plan was aimed at checking soaring pollution levels has taken effect. Now, the measures entail a strict ban on non-essential construction and demolition work, ban on BS3 petrol and BS4 diesel four-wheelers in Delhi and parts of the NCR like Gurugram, Faridabad, Ghaziabad and Noida, restriction on the use of diesel generator sets, while mechanized road sweeping and water sprinkling to suppress dust will be intensified. Public transport services and off-peak travel will be increased, while primary schools are moved to online classes. Now, truck drivers in Delhi have raised concerns about the potential impact on their livelihood, with restrictions imposed to limit the movement of BS3 petrol and BS4 diesel vehicles in Delhi and neighboring districts. Many drivers fear financial hardships, including difficulties in meeting loan repayments for their vehicles. Now, Delhi and its adjoining areas are covered in a blanket of thick smog. Again on Thursday, the air quality index crossed the 400 mark in many parts of the city, plummeting into the severe category. The government initially called the dense early morning smog a temporary development and had expected the situation to improve by Thursday. But with AQI levels continuing, it has had to implement GRAP, which is the third phase of anti-pollution measures that kick in when AQI levels turn severe, and that would be between 401 and 450. Now, during the winter season, GRAP measures are done in 4 stages. And what you see on your screens right now are the different stages of the level of AQI which is placed under them. GRAP 2 was enforced in Delhi in October when the air quality was recorded at over 300. For the first time this season, the air quality index of Union Territory Chandigarh crossed the 400 mark, reaching 436 on Thursday evening. It was the most polluted day of the year until now, with a higher AQI than even on Diwali night. This makes Chandigarh the most polluted city after Delhi. And it is not just Chandigarh. In the state of Bihar, with a severe air quality index of 427, Hajipur was the most polluted city in the country, even as 5 more Bihar cities, including capital Patna and Rajgir, apart from Hajipur, Patna and Rajgir, Muzaffarpur, Saharsa and Batia, also made it to the top 10 polluted cities list of the Central Pollution Control Board. And for more on this, we are now being joined by Dr. Vivek Nangia, who is the Chief of Pulmonology at Max Healthcare India. He's joining us live from Delhi. Thank you so much for joining us. Now, I would like to begin by asking you, considering the dangerous levels of pollution in the city, what kind of health effects are we looking at, not just for vulnerable people, but of course all the other residents?
Thank you for asking me this question. Well, actually, the kind of air pollution level that we're encountering these days, it is not just the people who are vulnerable who are affected, but anybody and everybody across the board would be definitely affected because of the such poor AQI levels. See, we need to understand that an AQI more than 400 is literally imminent, where it should be declared as an emergency situation, because the harmful effects of such poor quality can be very far and wide. If you break down the pollutants in the air into 2 parts, one are the particulate matter and then are those toxic gases. So particulate matter size of more than 10 microns probably, that results mainly in this irritation of eyes, nasal discharges, coughing, sneezing, itching in the throat. But the particle smaller than that, which is 2.5 microns and lesser, goes straight into the air sacs, and from where they get absorbed into the bloodstream and then cause systemic effects. So besides causing an impact on the lungs, which could be in the form of allergies, infections, pneumonias, tuberculosis, then going on to lung cancers, bronchial asthma, COPD. So we're seeing lots of young people now developing lung cancers. Traditionally, it was considered to be a smoker's cancer, but now we see a lot in the non-smokers as well. And I think poor air quality has a lot to do with that. So this is as far as the lungs are concerned. In children especially, you see lots of allergies, bronchial asthma setting in early. Then it can also impact our brain. In children, it could result in a slow brain development, growth retardation, brain retardation, mental retardation. In the adults, it can even cause strokes. There have been studies which have shown that whenever the AQI levels are so high, there's a definite increase in the number of patients developing heart attacks. They come to the emergency with myocardial infarctions or MIs as we call them. So all these diseases, it's not just really, confined to the lungs, but it could be impacting any part of our body.
Right.
And also, I'm sure you various studies which have shown that the life expectancy of people living in Delhi because of this air pollution is also going down significantly. Various studies have quoted figures that ranges anywhere between 2 years to 10 years is what you see.
Right. I would also like you to tell us about if you've come across patients during this period who are actually suffering due to pollution.
So we are getting to see two sets of patients these days. One's those who already are suffering with an underlying lung disease, like asthma, chronic obstructive pulmonary disease, interstitial lung disease, who are coming in with a flare in their symptoms, meaning that there's an exacerbation in the symptom. They're usually coming in with cough, which is incessant, not settling down with the routine medication, then breathlessness, which is requiring nebulizers, even steroids sometimes. Then there are this other set of patients who've never really had a problem, who basically are the first timers now, the newcomers, who are also developing the impact of this air pollution. These patients usually would come in with something which started with a sore throat, cough, cold, and then went on to breathlessness and developing wheezing in the chest.
Right. Now, the government of Delhi is trying to bring in different methods to curb the pollution. It includes the GRAP-3 method. Do you think that is enough?
Well, I guess this is an emergency kind of a situation where we should use everything possible to control the air pollution.
Right. Now, you're also amongst the pioneers to conduct various bronchoscopic interventions and medical thoracoscopy. Now, could you tell us what kind of suggestions that you give the patient, for example, the vulnerable ones, during this period?
So basically, I think, now the time has come where we need to go by the AQI levels outside. Depending on how the AQI is, we decide our daily plan. So if the AQI level is more than 200, then the vulnerable people like those suffering with lung disease, kidney disease, heart disease, they should restrict their strenuous physical activities outdoors, meaning they should avoid any marathons, exercising outdoors, taking a walk outside. If the AQI level is more than 300, then this vulnerable group of people should be staying indoors completely and not moving out at all. While those who are healthy with normal healthy lungs and no comorbidity, they should restrict their strenuous physical activity outdoors. This is just a rough figure that I'm discussing with you. And if it is more than 400, then I guess everybody should try and stay as much indoors as possible, restrict our outdoor movement, and especially we should go away from the concept of morning walks these days. We see a lot of elderlies who still insist on going for a walk in the morning, which can actually harm them. That is the time when the smog levels are the highest. So one is that. Second, of course, is that we should try and reduce our the burden on the streets, the vehicular traffic on the streets as much as possible. If you remember the COVID times when there was a complete lockdown in the city, there would be hardly any traffic on the road, and the AQI levels were also so much better. So apart from the various other factors that could be contributing to the poor AQI, I think vehicular emissions also has a major role. So if possible, we should move on to electric vehicles and reduce our emission as much as possible.
Right. All right. Thank you so much, Dr. Vivek Nangyat, for coming on air and telling us more and your perspective.
Thank you so much.